Good morning, everyone. I think we can start now. The time is moving really fast. My name is Naomi Nganga. I'll be the moderator for this session. And just to welcome all of you to our session today, where we will be discussing on rethinking public health through a culturally grounded lens. This session is hosted by International Center for Humanitarian Affairs, which is a research hub for the Kenya Red Cross. Maybe before we start, just some housekeeping rule. It will be good if you can be able to share your name plus the organization that maybe you're from. Also, maybe during the session, kindly mute your microphone, and you can also keep your video on. If you have any question to the speakers of the day, you can use the chat box to ask your question. We have our admin, Irene, who will be supporting in picking up your questions. And secondly, you can just raise your hand, and then I will be able to ask you to unmute yourself. In case of any challenges, again, with IT, you can also just put your question in the chat, and we'll be able to assist you. Again, we are very keen on data protection, and just to let you know that the session will be recorded, but we commit not to take pictures of the screen or other participants without your permission. So there is a functionality whereby you can turn on an AI generation caption to just do the translation. And how you do it, at the bottom of your screen, there's some 3 dots written more. You can just click on more button at the bottom of your screen, and then you can be able to choose, you just switch on the translation button, and then you'll be able to choose your language that you want to speak or to translate this discussion into. Yeah, so I don't know if we have any questions so far with regards to housekeeping. Yeah, I see Irene has already put in instruction on how to do translation on the chat box. You can always make reference to it. So our session today, just going back to the session, will be on rethinking public health through a culturally grounded lens. And maybe just to give you a background of this discussion is that, sorry, just trying to, is that many African communities use non-biomedical treatment, including herbal medicine, and also spiritual healing to promote their health. And in 2024, we conducted a study which explored how traditional and religious belief intersect with concept of health and also diseases and healing. So this study was conducted in the western part of Kenya, which borders Uganda. And Uganda has been a past Ebola virus disease outbreak zone. And we used qualitative research design, mostly focus group discussion, in-depth interviews, and also participatory workshop to speak with participants, including traditional healers, religious healers, patients of religious members, and doing participatory workshop with a healthcare provider, government, and relevant stakeholders who work in terms of providing health services to the different communities. And some of the key findings that we got from the study is that there are 2 main ways in which religious beliefs and also healing practices influence community vulnerability to highly infectious diseases. And one is that there existed a dualistic illness etiology that included both biomedical and also social cultural interpretation. And so these also determined on where to seek health services depending on how they interpret. For example, if it is a rare disease, then that means that the community might decide to seek health services from either traditional or religious healers. But if it is a disease that they believe is biomedical, maybe caused by viruses or bacteria infection, then they can seek services from the hospital. And then another finding was there are certain practices that complement infectious disease control, but of course there are also other religious and traditional healing practices that undermine interventions and health-seeking behaviors. And this we've seen from the recent outbreak of COVID-19 and also Ebola, for example, in Congo and Uganda, whereby there was conflict between government and also communities on how to conduct different health interventions that maybe the government thought were safe and could stop the spread of diseases, but communities thought otherwise. And so you can read more about this study. You can just scan the QR code. We published a paper that you can be able to get more information about the study through that code. One of the recommendations was the need to actively consider how local cultures interact with health concept to reconcile formal interventions with cultural practices. And so we thought that maybe for this workshop today, we will bring some of the people who've had first-hand experience in terms of responding to diseases outbreak here in Kenya, and they can share with us their views, their perception with regards to this topic. So we have 3 speakers for this session. We have Mr. Caleb Chemir, who is our public health we also have Ronald Chepkwesi, who is surveillance coordinator for Bungoma County, working with the Ministry of Health. And we have Mr. George Peter Manyasi, who is a traditional healer. So I will stop sharing my screen so that we can invite them to speak.
Hello.
Hello, yes.
Morning. I'm Nafula Vida, the focal person of Public Health and Emergency, Bungoma County.
My name is George Stuma Manyasi, a traditional healer.
Thank you so much, Mr. George, and thank you, Vida. So I will also ask Mr. Caleb to introduce himself. Caleb, if you can hear us.
Good morning, everyone. I can hear you, Naomi. And thank you for the opportunity to share our experiences and also just to paint a picture of the context of, the various options and avenues that individuals in Kenya seek healthcare services. So as rightly introduced, my name is Caleb Chemirmir. I work with the Kenya Red Cross as the Public Health and Emergency Manager. That is much about me. I don't know if I should go ahead and introduce more about myself.
Yes, you can in a few minutes, maybe in the next 2 minutes.
Okay, thank you very much. So basically, I have worked with the Red Cross movement for quite some while, over 15 years experience, together with additional experience in other humanitarian agencies. My background is in public health with a focus on public health in emergencies. Therefore, I'm responsible for supporting the National Society to be able to prepare, detect, and respond to public health threats as auxiliary to the government of Kenya. So that is specifically my role, just to ensure that we work closely with the Ministry of Health in ensuring that all the global health security concerns for the country are addressed. Thank you.
Thank you for that introduction, Caleb. Mr. Ronald Chepkwesi, would you also like to introduce yourself? Maybe if you're speaking, you're on mute. Kindly unmute. Mr. Ronald, are you able to hear us?
Allow me look for him bilaterally. This is Margaret Wambura.
Okay, thank you, Maggie. Maybe as we wait for Ronald to sort out internet connectivity issues, I will request that Caleb, maybe you, based on your experience working with Kenya Red Cross, could you kindly describe public health emergencies in Kenya, especially those involving highly infectious diseases, and what role Kenya Red Cross has been doing in terms of responding to these highly infectious diseases and also other health emergencies?
So thank you very much, Naomi. Over the years, we've been seeing an increasing and worrying trends as regards epidemics in the country, especially those which cause untold suffering and also spread very fast. If you look at the total number of caseloads for the years in the recent past, in the last 10 years, you're seeing an increase in caseloads as well as mortalities that comes with these outbreaks. Traditionally, we've had cyclic or every 2 or 3 years outbreaks of waterborne diseases like cholera. We are currently grappling with cholera outbreak in the country. Other outbreaks that have been persistent in the country include leishmaniasis, especially in the north arid areas. We also have challenges with viral hemorrhagic fevers, notably for Kenya is the Rift Valley fever, RVF, which are seasonal and peak during certain seasons. In the context of climate change, we are also seeing invasion of new species or vectors, which are more effective in transmission of diseases that are otherwise not common in certain areas. For instance, we have a new efficient or effective vector called Anopheles stephensi, which has penetrated or invaded the north arid areas, an area where we normally know to be low transmission for malaria, and we are seeing outbreaks occurring in those areas. Now, Kenya is a hub that connects most of the regional countries for trade and other socioeconomic endeavors. So Kenya connects neighboring countries in very many aspects. Trade, we have connection of the Mombasa port to our neighboring countries, Uganda, Burundi, Rwanda, Tanzania, DR Congo, and even South Sudan. Similar, due to conflict and all that, we have population movement flowing into Kenya via population movement due to conflict flowing into Kenya from the Great Lakes region, South Sudan, Somalia, and due to climate change and resource-induced population movement, drought and all that, population movement also from those countries. So that is the context with which the vulnerability of Kenya and the risk for spread of diseases occur. As we speak, we are having multiple outbreaks, not only in Kenya, but in the neighboring countries. We recently had the declaration of the end of Ebola in Uganda, but in the recent years, we've also had, just the recent few years ago, had other outbreaks of Ebola in Uganda and Marburg in Tanzania. All these areas are linked to Kenya via the trade routes or the transport corridors. So that is the context that which we are working with. As we speak, South Sudan also has a massive cholera outbreak. And some of the areas that we are speaking about are close to the Kenya border, part of the migration path of the asylum seekers from South Sudan into Kakuma and Kalobe refugee camps in the north western part of the country. So that is the context we are working with as a country. Just to mention that the Ministry of Health also has very well elaborate structures and technical personnel to be able to prepare, detect, and respond to public health threats at the national and subnational level. Institutions such as the National Public Health Institute has been officially launched, and that was last week, to be able to enhance the country's capacity to be able to prepare, detect, and respond to public health threats in line with the international health regulations of 2025. So Kenya Red Cross then therefore, through its legal mandate, performs an auxiliary function both at national and county level to be able to support the country endeavors towards keeping the population safe from these threats. Thank you.
Thank you so much for that, Caleb. And maybe just a follow-up question to Mr. Manyasi. Kenya being very vulnerable to different types of diseases, from your perspective, how do you recognize or identify highly infectious diseases in the community?
Okay, thank you. First of all, me personally, I'm a medical lab technician, retired, and happen to have worked with the primary healthcare programs when they started in Western. And I was able to assist in coordinating traditional healers at in Bungoma, Busia, and Kakamega. We find that most of our traditional healers normally they lack what we call exposure, based on type of diseases they diagnose. So it's important that through these kind of forums, our traditional healers will be able to come in and actually assist, especially when it comes on side of diagnosis, signs and symptoms. At times, some of them are not well exposed, or some of them are not well informed. But based on this kind of program, they are not able to diagnose at an early stage, but it depends on the number of cases that come in and at which rate signs and symptoms will help the traditional healers how frequent these patients are coming in, and sometimes their treatment may be a challenge when it comes to diagnosis, proper diagnosis. So at such a level, traditional healers need to be well interacted, especially as community health workers at the community level. It is important that they are actually involved at the grassroots level, and also timely awareness, education, if it's given to them, because at the community level, they are the first people to receive. Of course, generally, when you are sick, you have to seek the nearest service. So they normally get some of the patients, they go to them for, because not knowing what is actually happening. But the traditional healer will try his best. First of all, if it's highly infectious disease, you also look at the seriousness of the condition. So that time is when you will have to seek for medications. The challenge is that at most they will be receiving the patients on the site is when they will have to go out to seek for or to go and harvest herbs or medicine so that they come and to come back to treat the patients. So in such a case, you find that at the first stage, the patients will always approach the traditional healers at the community level because they are the nearest people for them. Two, another challenge is that not every village has a herbal practitioner. At least maybe at, for example, if it's in a ward, we may have one or two, and that shows it means he may receive a good number of patients coming to his clinic, and depending on the nature of his service, going to fetch medicine once he has received the patient. Some are not very well prepared, especially when it comes to medications. So in this case, highly infectious diseases in the communities, especially in Western, we are bordering with Uganda, and there is that flow in and out. Patients who come in, some can come from Uganda, some come from the other neighboring counties, and depending on also the experience of a given practitioner, sometimes they manage symptoms, but when it comes to proper diagnosis, is always actually a big challenge. So here, at least, there is need for our practitioners in collaboration with the Ministry of Health and relevant agencies, if they can involve the traditional healers at the community level at the earliest. In fact, they should be regular. In this case, so that they are actually updated the types of diseases that come in. For example, when it comes to cholera and Ebola, sometimes like cholera, it may take just very simple diarrhea and vomiting, and they may not come up with the proper medications to manage such cases. So it's important if traditional healers are involved in awareness forums and regular, so that they can help our patients. One thing is that they should help the practitioners where the cases they cannot manage, they are supposed to refer their cases the earliest they receive such cases where they are not very sure. So I think that is the challenge we are actually having in the rural area. And the traditional healers actually, given the information, given the proper training, I think they can be very good people at the grassroots level to identify cases in the early stages, and then they can help to refer such cases.
Thank you so much, Mr. George, for your discussion and elaboration on how the situation is on the ground and how you support the communities in terms of providing traditional healing and some of the challenges that also exist. So maybe just a follow-up question to that. Is there any kind of collaboration that is already existing with the healthcare side?
Yeah, there is. We have had Red Cross. We have worked with them at least more than twice, and creating awareness on the ground. Actually, that is one thing we have actually appreciated. Also, Minister of Health, we are in good terms because, as I said, we have the Kenya-Finland Primary Healthcare Program. These people are put under Community Health Workers Program. So, for example, the circumcisers, we have had the herbalists, we have the TBS. These people actually are supposed to be incorporated because they are working with the community. So actually, we have a very good relationship with the Minister of Health because they recognize them. They are not taken as witch doctors, but they are taken as traditional healers. So we know, in fact, we prefer using what we call alternative medicine because it's alternative because they actually they are the first people to receive the patients, and given the time, if they are given involved in this practice, especially when it comes to awareness. I think the Red Cross is actually doing a very good job because they are the ones who have actually, apart from the Department of Culture, it has been working with them, but it works on cultural basis. But currently, we prefer, especially when it comes to Red Cross. So when it comes to Red Cross, we have had a very good ample time, especially 3 times we have met. The traditional healers are now very eager. They would like to have more workshops. Apart from pilot areas they have been using, I think it's better if they can expand to other areas, especially involving the neighboring tribes, neighboring areas, like the bordering areas, the tribes, some other counties.
Thank you, Mr. Manyasi, for that. And Mr. Ronald, I hope that you're able to hear us now. Maybe you can introduce yourself. And there are a number of things that Mr. George has highlighted in terms of gaps that traditional healers have, especially when it comes to diagnosis of diseases, those that are highly infectious. And just wanted to ask, what are some of the ongoing efforts that you have within the Ministry of Health in terms of integrating traditional healers in disease preparedness and response?
Hello?
Yes, we can hear you.
Yeah, I'm Ronald Jepkwesi, public health by background. That is surveillance, that is Bungoma County. I think so far, having worked with the Red Cross and other related agencies, so far I can say we have efforts in place. That is, we have a Department of Culture and Gender that has established, and normally at scheduled times, normally the department normally meet the traditional healers. And by so doing, I think we have programs that have been initiated, that is like organizing traditional healers to organizing the traditional healers into national organization. This one enables that, or rather creates structures that allow better communication, coordination, and training among the key stakeholders. That is from the traditional healers and other related departments. Then another issue is actually we have training programs that we are doing as a department that is of health, that whenever we are doing, we have always brought the traditional healers on board to share and see how best we can approach the highly infectious diseases. Then another thing is actually we have encouraged that whenever traditional healers are coming up with herbs, it is good that they liaise with the department so that I think laboratory test can be taken to see if the issue of safety and efficacy of the drug. So far in Bungoma, I think we are coordinating, and I think all of us we are doing well. And anytime we are having an issue, we have always thought it wise to have all stakeholders brought on board. I know with the courtesy of Red Cross, we have managed to go through the teams or the groups of traditional healers. That is basically one we had in Sirisha, where I think where Mr. Manyasi comes from. Then we have another group that is towards Luahaga border, where we managed to visit. We have mamas who are religious, and also we have been able also to meet a group in Cheptais. And so far we are doing well, and we are working in consultation. And as a department, whenever we feel that there is an outbreak, for example, of an infectious disease, as a department, I think we have been able to supply, in case we have adequate essential supplies like the PPEs, we have been able to share with them so that by so doing, I think it assists us in preventing more transmission of this highly infectious disease. And again, we are also encouraging collaborations, that whenever we are doing, apart from the Department of, for example, Culture and Gender or other health, we are also encouraging further collaboration from other key other stakeholders so that we can work together towards preventing these highly infectious diseases. Thank you.
Thank you so much, Mr. Ronald, for that. And I see it's always good to hear that the Ministry of Health is working towards integrating traditional healers in terms of providing health services to the communities at risk. And Kenya Red Cross, having worked with both the Ministry of Health and also communities, maybe Caleb, you could tell us, in your view, what practical strategies or system do you think should be strengthened to ensure better health outcomes during emergencies, for example, for Ebola case?
Thank you. I think
Should I proceed?
Yes, please.
Thank you very much. There are several areas that we can improve as a country. And just to report to this forum that Kenya as a country has maintained a regular internal and joint external evaluation of our capacity to be able to prepare, detect, and respond to public health threats. So In the recent years, we've consistently conducted state party annual reporting. This is a IHR, or the International Health Regulation requirement for countries, to be able to self-assess its capacity alongside the global health security agendas that are there. There are core competencies that are looked into, cutting across the various response areas: laboratory, surveillance, risk communication, community engagement, amongst other things like zoonosis and all that. There are close to 15 or so core capacities that are assessed in the annual assessment. So this is in-country assessment that we conduct every year under the leadership of the Ministry of Health, and Kenya Red Cross is one of the partners alongside WHO, UNICEF, and other partners, to be able to assess at the national and county level how ready are we as a country, and we use those performance to improve. Every 5 years, we conduct joint external evaluation, which is otherwise called JEE, and the most recent one was done early this year, and the report is available, which shows which areas are we weak and which areas are we strong. I will not go into the specifics of this area, but critically look at what could we do better as a country in the context of, the highly infectious diseases, and for instance, the risk or the likelihood of, Ebola outbreak in the country based on what is happening in the neighboring countries. One major area that we need to look at overally cuts across the various health systems capacity. One of the challenges that we do get often is how fast we are able to detect. This in the sense of what is our laboratory capacity. In certain areas, it takes quite a long time before a case or reported cases are properly investigated. In the recent months, we had reports of some respiratory illness in northeastern county of Mandera, which took quite a long time before the investigation team got to the site, not because they could not do that, but because of logistical capacities. But at the same time, getting the samples, running the samples required shipment to Nairobi. So those are some of those capacities that we need to look at if we could strengthen the lab capacities in certain areas that are disadvantaged in terms of physical infrastructure and the necessary reagents and personnel to run those samples closer to those disadvantaged areas. Of course, there are some capacity gaps, which we continue working closely with the national and county governments with technical oversight by WHO or support assistance to ensure that we continue building the capacities of our healthcare workforce to be able to strengthen our preparedness and response to these threats. There are some capacity gaps in terms of infrastructural facilities, strategic in this sense, just to ensure that we have adequate isolation facilities and even facilities that will allow for treatment of these highly infectious diseases. This is in the context of the resources that are available. So it's a tricky balance just to see where, as a country, we could ensure that we have adequate facilities to be able to receive and treat, these highly infectious diseases like Ebola. Where would it be strategic to do that? We made significant progress during the the COVID outbreak phase, but the requirements, infection prevention control requirements, and all the other supplies necessary, including the health workforce necessary for such threats like Ebola, would be a little bit different, and therefore that is a gap to look at. I would also want to skip the health system and just talk about what happens in the community. There are health-seeking behavior gaps. This is critical just to ensure that our population fully appreciate the risks that are there because of where we are positioned geographically in the region, and improve and work on improving the health-seeking behavior. Work around misinformation or disinformation or infodemics that come through because of these diseases, and strengthen our engagement with traditional and even religious leaders and healers in the context of, what role would they then play in the whole chain, from surveillance and ensuring that the communities also seek appropriate care when this happens. So in a nutshell, that is what I would put it in terms of areas that as a country we can improve. Back to you.
Thank you. Thank you so much, Caleb. And I see we need to close this session in the next 5 minutes. And I wanted to give maybe an opportunity to our participants to just ask a question to any of our panelists before we summarize the session and close it out. It was a short session, but we hope that from this you've learned a thing or two, and maybe we can organize for another webinar where we can have a bit more time to just share. I would like to open the floor to anyone who has a burning question to ask. You can just raise your hand. Mr. Wanyas, you wanted to add something? You can proceed.
We need to incorporate these traditional practitioners, bearing in mind that we know most of our people have what we call mindset and prejudice based on the colonial mentalities, whereby religious people and traditional healers cannot work together just because of faith and culture. So I think this is one area we need to integrate these people so that they work together. They are involved in more forums to be created so that at least we have regular forums. And when it comes to like what Mr. Chikwe said, if the traditional healers are actually received properly without, assuming them to be witch doctors, they are actually practitioners. On one point I want to come up with is that we have a lot of resources, especially when it comes to our herbal medicine. We can even come up with the new herbs medicine to treat our people, at least at that community level. So I will pray that the faith-based organizations and the traditional healers should work together with the Ministry of Health, especially when it comes to Red Cross, whereby example is Red Cross. Red Cross has no boundaries. So I think if we can follow up that under that forum of the Red Cross, I think health challenges cannot be there.
Thank you.
Mr.
Hello?
Ronald, to give your remarks also as we close.
Yes, sir. I think one issue which the count so far has not embraced is the issue of One Health approach. And I think this is very key in terms of actually addressing human, animal, and environmental health. This is particularly in targeting zoonotic diseases. So if the county can embrace the One Health approach, I think it will assist us also in actually tackling the issue of highly infectious diseases. Thank you.
Thank you so much. In the next 1 minute, we'll be closing the session, but I want to thank you, our panelists, for sharing your knowledge with us. Thank you, the participants, for joining the session. We really appreciate you. I see there are some questions in the chat box. We will compile them and email the responses to you. And we will also inform you on when we can hold another session on this topic. So a key takeaway will be like the traditional healers are also practitioners, and there's need to integrate them in the formal public health system. And this calls for a paradigm shift from top-down health interventions to a community-centered approach where local health behaviors and also their rationalization are central to the analysis. We thank you all for your participation, and we really appreciate all of you. So thank you so much, everybody, for joining this session.